Okay, hi everybody. Happy Friday. And here we're coming into a holiday weekend, and I thought it would be nice to maybe end the week on a positive note. I want to give you some actual cases from my practice that had great success with peptides. And they're different peptides and they're different people. I'm not going to obviously mention their names because that would be a breach of privacy, but I'm going to do kind of like a case presentation that we do when we get together in these big conferences with other doctors and other healthcare providers. So let me start with a case of a, excuse me, a 79-year-old man who was otherwise healthy, who presented with persistent infectious symptoms. He had a fever over 100 degrees. He had a very productive cough, which means he was bringing up a lot of junky stuff out of his lungs, and severe malaise. So he was very, very fatigued, no energy, just really didn't feel well at all. Now, he had taken the flu shot, as he does every year, but he got sick anyway. And I'm sure you've either experienced that or you know of somebody who has experienced that, unfortunately. So he was treating himself at home with supportive measures, which was typical of a viral illness. But the productive cough was not getting better. In fact, it was getting worse. And of course, there was concern for the development of pneumonia. I had offered him Thymus Alpha1 as one of the peptides I've talked about a few times here when he first showed symptoms. But he's a patient who's what we call needle averse. He really doesn't like injections, and he really thought that this would just go away on its own. But after a week, when the cough was becoming more productive and the fevers were not going away, and it looked like he was actually getting sicker and not better, he said, yes, I'll take the Thymus Alpha1. So I provided him an intramuscular loading dose of Thymus Alpha1, and the plan was to do that daily for about 3 days to stabilize the symptoms and make sure they're getting better. But within 24 hours of just one loading dose of Thymus Alpha1, he started to improve significantly. Fevers went away, the cough improved, and he finally just recovered. So I'm certainly not suggesting that Thymus Alpha1 replace going to the hospital or the ER when a patient is super sick, but it has been extensively studied and can be used safely in a wide range of patients. The youngest I know of is about 15 months old, up to 101 years old. And this is a naturally occurring peptide in our body. So I thought that might be a nice case for you all to know about. The next one I'm going to share with you is a 35-year-old female with a complicated medical history, including a mixed autoimmune syndrome. She works in a busy doctor's office, so her immune system is challenged frequently with exposure to sick people all day long. And one day, on a Friday, late afternoon, she developed a horrific case of shingles with a large rash that started on her back, and the pain was just horrific, unbearable. Many of you may not know this, but with autoimmune patients, when they get the shingles, it can be very, very severe and last for a really long time because their immune system is dysregulated. So I was able to get the Thymus Alpha1 to her that same day. She had used Thymus Alpha1 successfully before to treat the flu and some other infectious illness that she had contracted, and it's a peptide that I make sure is available for her with her history. And she administered a loading dose intramuscularly, was able to start the standard antiviral treatment over the weekend, which is really important with shingles. But she was better in 2 days and able to go back to work by that following Monday. The rash and pain had resolved in just a couple of days, which is pretty impressive under the circumstances. So, awesome little peptide. Another one that I wanted to share with you is a 62-year-old male patient who presented to me, that means he came to the clinic with, a 3-month history of right knee pain and daily swelling. He plays tennis about 5 days a week, and the knee was swelling and hurting every time he played, and he would ice it at night, pretty much every night. The twisting movement across the court were exceptionally painful. The lateral side, or the outside, there's the inside of the knee and then there's the outside of the knee. The lateral side of the knee was more painful than the inner side of the knee. On MRI, it showed that he had a torn meniscus, the anterior horn of the lateral meniscus, so the one on the outside of the knee, mild lateral outside of the knee compartment arthropathy, which is the joint is no longer looking pristine, and a laterally tilted patella, which is the kneecap, with the undersurface of the patella showing less cartilage. So we've got some cartilage wear there too. There were also some small cartilage ulcers in the posterior lateral femur and tibia, so that the femur is the big long bone of the thigh and the tibia is the bigger bone in the lower leg. So the MRI report didn't mention much about the proliferated synovium other than mentioning synovitis. So the synovium is the lining of the knee. It's a really important structure. It helps with secreting the normal joint fluid in the knee. It exchanges nutrients in the knee. It's a really important structure and has a lot of nerves in it. And synovitis, which is when that synovium is inflamed, is very painful and it can cause a big effusion and swelling of the knee. And when I looked at his pictures, the report mentioned it, but it didn't really talk too much about it. But when I looked at it, the MRI pictures, I could see tremendous synovial proliferation, meaning the synovium had, gotten much thicker, much bigger, and that's usually kind of a chronic irritation response. So if there's a chronic irritant in there, it just starts to proliferate and get kind of thicker, and it doesn't necessarily mean it's a healthy situation. It can be very painful. So we discussed options, including platelet-rich plasma or cellular options, but I really wanted to get that internal environment of his knee much healthier. And I felt like that synovium looked just so painful that if we could improve that, a lot of the everyday swelling and the pain coming from the knee would be much better. His cartilage also needed a little love, and so I used my favorite combination of the pentosan polysulfate intramuscular injections and the AOD 9604 combined with hyaluronic acid into the knee joint. And I did that once a week for 5 weeks. And before we started, actually, I should have mentioned this before I put anything helpful into the knee, I actually took out a lot of that. I went ahead and drained out the fluid. That fluid that sits in the knee for a long period of time is not serving you at all. It's a kind of what we call a toxic fluid. It's full of inflammatory stuff and cytokines and things that are not going to make the healing happen easier, especially if you're doing something regenerative. And sometimes just the persistent presence of that fluid is very acidic. It's not a good situation. Getting that out, what we call lavaging the knee, so pull the bad fluid out and wash the knee with some normal saline, clean normal saline. Get all those toxic mediators out of there. That can provide significant pain relief in and of itself sometimes. But I definitely wanted to get that out before we put in a healing substance to try to have only positive things in contact with that synovium. So lavage the knee, and then we started with the every week injections of the AOD in hyaluronic acid. And I had mentioned that peptide before. The hyaluronic acid that it's made with is a very specific molecular weight. It's not just combining AOD with some hyaluronic acid that you're buying separately. It's really combined together in the compounding pharmacy when it's used this way. So then wash that out, treat it for 5 weeks, preparing that if we still had pain from any kind of instability, especially on that lateral side, we would maybe do PRP. But after 5 weeks of treatment with the peptides, he returned with no pain in the knee, no swelling after exercise and tennis, and no further need for treatment. So it was all better with just the peptide therapy. And a lot of times there will be more that the peptides, I can look at the knee and I can say, well, we have these problems inside, or we have edema in the bone and there's something we might want to do about that. And we may want to combine the use of peptides with a regenerative procedure to get the optimal result. But in his case, I really felt like we had a good chance of getting him better by using this peptide combination. And so he was better. So one more case, 64-year-old female who presented to me with a mild to a moderate recurrence of right shoulder pain. She had injury and problems with the shoulder and had a stem cell treatment in 2018 to both shoulders. The right one was bothering her much worse than the left one was. She was very limited in what she could do, range of motion, what we call range of motion. she couldn't move that shoulder very well at all. It was already starting to get kind of an adhesive capsulitis or frozen shoulder in there from this chronic inflammatory response. But her left shoulder was hurting her as well. She had a successful stem cell treatment in 2018. The left shoulder, great. No recurrence of problems. The right shoulder did excellent. It was 85% better for about a year. And then she started to have a little bit of recurrence of the pain and a little bit of a recurrence of the limitation in the movement. And before her stem cell treatment, she was up to like an 8 out of 10 pain, very serious pain. For those of you who have not had problems with your shoulders, bless you, because they really hurt. They'll keep you up all night long. You can't reach over, head to do anything, if you needed to do that. So getting them correct, it's really important to do something about those shoulders. She did really well, started to have some pain creeping back in. And at that point, what were her options? So she could have gone in the traditional model. She actually had, I think somebody tell her, just live with it. It's not that bad. And you can always just do nothing. That's always an option, but it's not a great option, I don't think. You have something that maybe could be better. You can do more physical therapy. That's always an option. Sometimes they'll say, let's put a steroid injection in there. Now, a steroid injection had not helped her at any time before she had the regenerative procedure. And usually at best, that's a bit of a Band-Aid. Sometimes it can reduce the inflammation. And if it's just an irritation in there, it might be fine. But if there's issues in there, once the steroid isn't there anymore, those issues often will come back. And steroids have some side effects that aren't terrific for us. So, but those were also options for her. Or she could have gone in and done a kind of a touch-up regenerative procedure to the shoulder. But she still had really good function with her shoulders from her successful stem cell treatment. And I felt her long-term outcome could be improved with peptide therapy. So that's what we did. I started her on a copper GHK, which I've talked about before, tremendous at collagen, tremendous at modulating inflammation and helping repair. BPC 157 combined with thymosin beta-4. She did those subcutaneous injections, just little injections in the belly like you would with an insulin needle. And I provided her a topical, a cream that had the BPC in it and the copper GHK to apply to her face and if she wanted to apply it to her shoulder as well. At her 3-month follow-up, she was pleased to report she had no pain in her shoulder since starting the peptide therapy. And this was a pleasant surprise for her. Her rosacea had completely resolved on her face using the cream and using the injections. She also had more energy and just felt better with using the peptides. So those are some examples of why I love the peptides that we've talked about. I use them, the peptides that I mentioned, especially the Thymus Alpha1, is also extremely effective in chronic inflammatory conditions, in conditions where the immune system just isn't keeping you as healthy as you'd like it to, or it's gone overboard and it's overactive and it's dysregulated. It's a very safe peptide. It's often a first line when we're dealing with an inflammatory situation, and certainly with an autoimmune situation. We're seeing a lot more autoimmune conditions cropping up in the last 10 to 15 years. There's a lot of speculation as to why that is, but either way, we certainly want to get on top of that to provide a much better quality of life and keep everything less painful, less inflamed. And if your immune system's not working properly, your chances of having some serious illness or even cancer go up. So we want the immune system to work as well as it possibly can. And so I hope you enjoyed the presentation of these patients today. I know it's a short one today. I want you all to have a wonderful holiday weekend. I know it's not quite the same as the Memorial weekends we're used to having, but it'll still hopefully be a time for restoration, relaxation, time with your loved ones, and I will see you next week. You'll get an email earlier in the week next week. We're going to start talking about a few things that we're looking at for summer, and as well, if you want the peptide guide, you can go to drheather.net/Peptology guide. I've mentioned it a few times before. It's just the top 10 conditions or top 10 common conditions that peptides can help with. And if you're looking to become a peptide patient, if what I've said sounds interesting to you and you'd like to see if anything might be able to help you, you can go to drheather.net/contact and just reach out to us and let us know that you're interested in that, and we'll see what we might be able to do to help you. And of course, I'm training physicians as they're interested in how to use these peptides together. I would love to have everybody have access to this technology. It's awesome. So I'm going to sign off early today, and thank you again very much for your support, for coming to this on Fridays and sharing this time with me. I really, really appreciate it. Stay well, and I'll see you next Friday.